Massive chaos outside the SASSA offices here in Bellville. Again this morning, of course, it is the situation that has been unfolding at various SASSA offices across Cape Town over the past week or so. Of course, this directly related to the lapsing of the temporary disability grant at the end of December last year. Now, this morning, speaking to some of the residents here, and of course, over the past 2 days, there was blistering heat in Cape Town, temperatures in excess of 30 degrees. This morning, rainfall, and quite disheartening to see some people. I saw a gentleman, his sister telling me that he had just been discharged from hospital, sitting in the rain in wheelchairs as the push to reapply and also apply for the temporary disability grant and other grants. People coming to offices. We know that this office at Bellville itself was closed in this week due to COVID-19, and of course the situation exacerbated with people crowding around trying to get in. Police as well as public order policing were called in to try and maintain queue control and also to make sure that the relevant protocols are observed when it comes to COVID-19. Now, joining me is the CEO of SASSA, Ms. Totsie Memela Khambula, and I'm going to speak to her in just a second. Ma'am, a very warm good morning to you. So just in terms of what you've been doing here this morning, we understand that there were quite chaotic scenes. People are rushing to renew and also to apply for their grants at this point. You've been out here discussing with people. Tell us in a nutshell, what is happening at this specific office? What are the measures that you're putting in place at this office today to make sure that the hundreds of people here will be assisted sooner rather than later?
What we found is that because we had this office affected on Tuesday by COVID, it was closed, and it was the day when we were supposed to help the people with temporary disability. So the people that were supposed to come on Tuesday, they've come today, and the people that were supposed to come today have also come. That's why we're having the challenge that we're having. What we're therefore doing with the team is we've worked from the back and from the front. First, we started by taking those that are immobile, those in wheelchairs, and those that are actually on crutches, and prioritize them so that we can service them as quickly as possible. And then also going to the back and making sure that we can, even though we don't have electricity like we have load shedding today, to make sure that we can take the 3G cards and make sure that we book appointments to all the people that are here.
So those people who will get their appointments, at what point today do they get told that they have appointments in order to alleviate the queue here?
That's why we're taking the IDs, we go inside, we book them for the appointment, we come back to them, we give them the date so that they don't have to sit here the whole day, and prioritize first those that are immobile and then prioritize those that are at the back, so that we can make sure that sooner rather than later we can get the people to be able to go home. In the other offices, because we put the system already on Tuesday, you don't have the crowding that you're having. But the other key thing that we're doing is to make sure that we don't only focus on people applying for the temporary disability, but they can also apply for social relief at the same time, so that we can tie them over whilst they wait for that process. And we've already put a system with the team whereby your social relief, because we don't want to do food parcels anymore, we will pay the social relief money as soon as we process it in the people's bank accounts. We've already engaged the post office that already has the bank accounts of those individuals, so that we can take the money and actually put it in their bank accounts whilst they wait for the...
Ma'am, there have been calls from civil society for an automatic extension of the temporary disability grant. Was this something that could have been foreseen? Your department could have done something different to prevent what we've seen over the past few weeks?
We had already, through government, because we get money from National Treasury, we had already extended the temporary disability grants twice. So for those people whose grants expired in February, they were extended until December. There is no way I can make a decision to say I have extended further, because in all instances we actually get an allocation from National Treasury on what it is that we need to do. I know that some of the civil society organizations are saying just extend it because you do have the money. It's not the case. We have one bucket money and we take all the grants. Now with people actually becoming unemployed, what we have is our child support grants, the numbers have increased and we have one bucket of money. So we've had to make sure that the mothers that are now unemployed, we can make sure that their children can also get support. We would love to extend forever, but again in terms of the rules, why temporary disability is always for 6 months and 12 months is because the doctors are saying your condition is fixable. It's not for me to define whether the person should have a temporary disability or permanent. It's the doctors that actually say your condition is fixable. If it's permanent, it then becomes permanent. But again, we can't say people that, because the key is, and we know that we have a major challenge with regards to jobs. We have a major challenge with regards to unemployment. So some of the challenges are created by the other challenges we have as a country. You find more, like now we're going to have more people that are having COVID that are going to be sick, that we're going to have to put on temporary disability. So this, unfortunately, but we know that it's our responsibility, it's our job to serve the vulnerable. Hence we took even the managers at regional office who said we have to come and help this branch, because the other branches are fine now because they've set the appointment. But here, because we couldn't work on Tuesday because we had COVID in the office was closed.
Ma'am, thank you very much for speaking to me. Of course, the CEO of SASSA just explained to us the situation and what has arisen after the closure of this Bellville SASSA office on Tuesday due to issue of COVID-19. Of course, like I've mentioned earlier on, quite a number of police are still on the scene to ensure that social distancing measures are being adhered. And if I can ask my camera colleague Clinton Serve just to pan over to my left, just to show you that what has happened since this morning when a throng of people were gathered outside the doors of SASSA here. There has since been police tape cordoning off the entrance. Of course, what you'll see on screen at the moment are two rows really. Those that have been identified as extremely vulnerable, people in wheelchairs, etc., have been put into one queue. And also we've learnt that today about 110 people will be assisted here at the SASSA office, and as you can see, the queue is moving at this point in time. And as the CEO told us just now, that the rest of the people, what they are doing is making sure that people's IDs are taken and then they are being given dates, and that of course is the booking system that they say will alleviate the kind of crowds and the congestion that we've seen at various SASSA offices across Cape Town, of course exacerbated by that lapsing of the temporary disability grant at the end of December. Of course, we will be keeping a close eye and just if I can reiterate again, a lot of the people here today giving us heart-wrenching stories of, for example, one lady saying that she spent the night on Tuesday evening at, for example, in East River, and only to be told to come here today, and of course having to face what seemed like chaotic scenes this morning. Earlier this morning we were also at the SASSA offices in Gugulethu, where there earlier in this week as well we've seen scenes of people sleeping over on cardboard boxes outside the offices in fear of losing their space in the queue. This morning with some rainfall coming down, some of the residents there also telling us that even though they were given dates, they are still standing for a few hours waiting to be helped. So of course at this point in time all eyes will be on how quickly the situation can be resolved so that the most vulnerable of society are assisted, especially in this time of COVID-19 where many are entirely dependent on social grants for their day-to-day needs and basic necessities.